This video is on waxing, eyebrow, and lip. We're going to go through all the procedures. So some of it will be read and some of it I will be doing as we go through. Before your client comes, you're going to want to prepare your area. And with that, you want to disinfect your workstation, your bed, and equipment using a disinfectant wipe, following the manufacturer's instructions. Check equipment to ensure that all devices are in safe working order and plugged into a working receptacle. You want to gather clean supplies needed for the service, and then you dispense products needed for the service. Prepare disposable cups, portion cups for each product with a portion of the product by opening the top of the container and ensuring the tip of the nozzle does not come into contact with the disposable portion cup or tray, or remove the product with a disinfected or clean single-use spatula. Close the lid to the product and set the portion cup or tray on the tray. You're going to place disposable table paper on the disinfected bed to ensure the wax does not fall onto the bed. And then your client's going to arrive, and so you will, we're going to wash our hands again, but you would always greet your client with already washed hands. So you're going to greet and escort the client to the work area, and you'll assess the client's current style and determine the client's preferences. You'll assess the client's needs. You assess the client's skin by performing a skin analysis visually to ensure that there is no inflamed, infected, broken, raised, or swollen skin in the area that's to be worked on, or an open wound or sore in the area to be worked on, an infection or infestation such as lice, to prevent from safely performing the service. You'll assess the client's consultation form for any medications and products used within the last 72 hours. You'll consult on any known allergies. You're going to consult with the client on any facial surgeries within the last 3 months, and if the client's under physician's care, you'll assess if the client is prone to cold sores or fever blisters. You'll assess if the client has used exfoliating or lightening agents within the last 72 hours, such as alpha hydroxy acids, beta hydroxy acids, hydroquinone, etc. You'll assess facial injections within the last 3 weeks, Botox or hyaluronic fillers. If the client is free from any of the above, we can move forward with the procedure. So we are going to get her set up, and then we're going to wash our hands. So we have our client disrobe accordingly for the service, and that we will be putting her down, and I'm going to adjust this so you can see the client, and I'm going to get her ready now. I am going to get a headband. To put that on to keep the hair out of her face while we work. As well. There we go. And I'm going to drape her so that nothing would get on her or her clothes. I'm actually going to put a rolled towel, I think, under her neck as well for a little bit more support there while I'm doing the waxing. And I have all my supplies set up on the tray here. I've got everything set, all my strips, tweezers, small scissors, a mirror for her to check and assess I've got all the things, and then I'm gonna do the next step of the service, which is once the client's prepared, I'm gonna wash my hands. So in order to do that, sorry, just trying to figure this out. There. In order to do that, I need to turn on some water, and I will be turning on the water and wetting my hands, and then getting a coin-sized amount of liquid hand soap, and I would rub my palms together down to my wrists. Speaking of which, this should not be on. Down to my wrists. I would be rubbing the back of my hands, and then all the way down to my wrists. I would be interlocking my fingers, and in between my fingers and my thumbs, fingertips, nails, backs of fingers, thumbs. We would be interlocking fingers for a minimum of 20 to 30 seconds to under the water, really washing really good. We'd be washing wrists. And then we would be doing a thorough rinse underneath the water. Once it's properly rinsed, we grab a disposable paper towel. We turn the water off with the disposable paper towel, and we dry the hands and arms thoroughly. And then we are going to discard the paper towels and into the trash can. And then we find our hand sanitizer and we sanitize completely, doing all the things that we just discussed between the fingers, backs of the fingers, palms, hands, everything. And once they're dry, we are going to apply some gloves, because we're not going to do this service without gloves. So the first thing that we want to do in the service, she's draped, is assess the direction of the hair growth. So that's what I'm going to do first. I'm going to see which way her eyebrow hair is growing, since we're working on eyebrows first. And then I am going to go ahead and do my pre-epilation product cleanser to the brow area on both sides with a cotton pad, cleaning everything thoroughly. And then make sure that everything is super, super, super dry. I'm going to use another dry cotton round. Make sure everything is cleansed and dried beforehand. And now we're going to test the temperature of the wax. Super important to do that. So we're going to do that within our wrist. So I'm going to go over to the wax, get a little bit. Get a strip. It does not feel too hot to me. And it feels good and ready to work. So we're going to apply wax. We're going to use a little remover here on this side. Any wax residue. Going in to get any stray hairs. that skin nice and tight. And that's part's good. I'm gonna remove anything extra wax that might be left behind. Get my tweezers. One more little area for the eyebrow. Let me get the middle here. Always want to apply that wax in the direction of the hair growth. Looking good. Brows look awesome. So we're going to follow up with our post-epilation product. Soothing. Then we're going to move down to the lip area. Assessing the hair growth. We have already tested the wax temperature, so we know it's okay. tweezers. And then we have our soothing step. And once finished, you can bring in your mirror, let the client take a look to make sure that she's happy with everything that she sees. And she is. And then we would remove our gloves and discard in the waste receptacle. And then we're going to meet with our client and follow up on maintenance and aftercare. We discard single-use items. We place implements in a closed container that's labeled to be disinfected. We place the cape and towels into a closed container until laundered. We clean up our work area. So we identify proper cleaning agents and read manufacturer's directions. We follow manufacturer's directions for mixing and usage. We wipe our workstation area with cleaning solution to remove debris. We identify disinfectant that is bactericidal, virucidal, and fungicidal, EPA approved for use in salon setting. We follow manufacturer's directions for mixing and or using appropriate aerosol disinfectants. We disinfect electrical equipment stored in a clean area separate from other implements. That's too loud. We then go through our hand washing procedure. So we've used some bactericidal, virucidal, and fungicidal products. We would have had gloves on for that, so we're going to throw those away again, and then we're washing hands. So we're going to turn on water, wet our hands, and then we're going to place a coin-sized amount of hand wash in our hands. We're going to rub our palms together, and we're going to rub the back of our hands down to the wrists. We're going to rub between the fingers thoroughly, washing the fingers, the backs of the fingers. We are going to be washing in between our thumb and our fingers. We're going to wash our nails and fingertips on both hands. We are going to make sure that we're doing the interlocking motion with the water for 20 to 30 seconds minimum. We're going to wash our wrists, either side, of course, rinsing thoroughly under that water. And when we have properly rinsed and washed our hands, we find paper towels and get some of the disposable towels, turn the water off with the hand with the towels, and then we completely dry off our hands, arms, wrists, everything. Once that's totally dry, we're going to discard the paper towels that were just used into the waste receptacle, and then we locate our hand sanitizer to complete the hand wash, and we take care of that, doing all the same things that we just did with our regular cleansing step, the first part of the cleansing step. And once you have done all of those things, then you know you are ready for your next client, next kind of service, etc. So that's the basic steps of waxing for eyebrow and lip combined on a video, and moving on to the next service or client.